is Manilin Lisay Ardales. I'm a second year nursing student of Tanchuling College. So, today I'm going to talk about bemonc and cemonc. Bemonc is the acronym for Basic Emergency Obstetric and Newborn Care, and the cemonc is the Comprehensive Emergency Obstetric and Newborn Care. So, bemonc is referred to a life-saving services for emergency maternal and newborn condition or complication being provided by a health facility or professional. So, the following are the services of bemonc. First service is the administer parenteral antibiotic. So, administration of parenteral antibiotic to prevent puerperal infection. So before we administer this drug, we need to review the 6 rights of administration medication. So it is the right patient, right medication, right dosage, right time, right route, and right documentation. So it is important to know because we want to avoid error. And also it is important to check for the allergies before administration kasi may mga patient na meron silang allergy doon sa drugs na yon. So once po na yung patient is may allergy po siya doon sa antibiotic na yon, hindi po natin pwede yung drug i-administer doon sa patient. Now I am going to administer the antibiotic through intravenous line. Inject it slowly, and after injecting, remove it. So the second service of bemonc is administration of parenteral anticonvulsant for treatment of eclampsia and pre-eclampsia. So in this case, magnesium sulfate is the best medicine prescribed. So what is pre-eclampsia? Pre-eclampsia can cause your blood pressure to raise and put you at risk of brain injury. It can impair kidney and liver function, cause blood clotting problems, pulmonary edema, seizure, and in severe form of left untreated maternal and infant death. So imagine this is the IV site. So I am now going to administer the anticonvulsant drug. Inject it slowly. So third is the administration of parenteral uterotonic drugs for postpartum hemorrhage. So what is uterotonic drugs? So uterotonic drugs are medication given to cause human uterus contraction or to increase the frequency and intensity of the contraction. Uterotonic are used both to induce labor, to reduce postpartum hemorrhage, and oxytocin is recommended to administer before delivery because oxytocin stimulates powerful contraction that help to thin and open the cervix, move the baby down and out of the birth canal. So it push out the placenta and limit bleeding at the site of the placenta. So I am going to administer uterotonic drug through intravenous. Imagine this is the IV site for. So fourth is the manual removal of placenta. The placenta is expelled from the body after the birth. Usually about 5 to 30 minutes after baby is born. So manual placenta removal is the evacuation of the placenta from the uterus by hand. It is usually carried out under the anesthesia or more rarely under the sedation and analgesia. A hand is inserted through the vagina into the urine cavity, and the placenta is detached from the urine wall and then removed manually. When we are removing the placenta, we need to follow the umbilical cord to the placenta. Insert your So the fifth is the basic neonatal resuscitation. So it is defined as the set of intervention at the time of birth to support the establishment of breathing and circulation. So it is the emergency procedure focused on supporting the approximately 10% of newborn children who do not readily begin breathing or do not breathing. So in performing neonatal resuscitation, I need stethoscope to check the heart rate of the baby, the bag bulb mass, and two clean towel. So it is very important to dry the baby thoroughly and then remove the wet towel from the baby. Wrap the baby using the dry towel. In assessing the baby, you need to look for her color, tone, the breathing, and heart rate. Baby is not breathing, we need to give her 5 inflation breath. So in order to give the baby inflation breath, we need to find an appropriately sized mask. So we are going to give 5 long sustained inflation breath. So this breath should be last 2 to 3 seconds. So imagine this is the bag valve mask. So when we are performing this, observe if the chest is rising and thus initiating that I get inflammation breath. So start 1, 2, 3 off, 2, 2, 3 off, 3, 2, 3 off, 4, 2, 3 off, 5, 2, 3 off. So cemonc is the acronym for Comprehensive Emergency Obstetric and Newborn Care. It is require surgical skills and thus it usually provided by the doctors in the hospital setting. It is the intervention provided to pregnant women and newborn experiencing fatal complication, including severe bleeding, infection, prolonged or obstructed labor, eclampsia, and asphyxia in the newborn. So, cemonc intervention includes safe blood transfusion, providing oxytocin and antibiotics, performing cesarean section, manual removal of the placenta, and assisted vaginal delivery, abortion, and resuscitation of the newborn. One of the service of cemonc is performing cesarean. So, if the babies are too large for the birth canal, slow cervical thinning and or carrying multiples can prolong the labor. So, in these cases, doctor consider a cesarean to avoid complications. So, another reason for cesarean section is the abnormal positioning of the baby and the fetal distress. So, the doctor may choose to deliver via emergency cesarean if your baby is not getting oxygen enough.
In this video, I was assisting the physician for cesarean surgery, and imagine we are wearing personal protective equipment.
And also, women may deliver via cesarean if they live with certain chronic condition like heart disease, high blood pressure, gestational diabetes. Vaginal delivery with one of these conditions may be dangerous for mom. And also, doctor will also suggest a cesarean section if the mom has an HIV, genital herpes, or any other infection that could be transferred to the baby through vaginal delivery. And also, another reason is the cord prolapse, cephalopelvic disproportion, placenta issue, and etc. So the next service of cemonc is the blood transfusion. So before we proceed to blood transfusion, we need to verify the order of the physician, and we also must verify the blood before the start of procedure, just to avoid error.